Hello, my name is Dr. David Schwaber, and I would like to talk to you about a solution for people who have snoring and sleep apnea. Oral appliances, which are worn in the mouth like retainers, have proven to be a comfortable and effective choice for patients who have the symptoms of sleep apnea, such as tiredness, snoring, and poor sleep. Many patients who are unable or unwilling to use CPAP machines have benefited from using oral appliances, which have been recommended by the American Academy of Sleep Medicine in the treatment of obstructive sleep apnea. As you have been selected by your sleep physician or doctor as a candidate for oral appliance therapy, you have undoubtedly already had a polysomnogram or what's called a sleep study. First of all, I'd like to review a summary of your sleep study to become familiar with the nature of your sleep disorder. At our office, I will do an examination of your mouth, including your teeth and your upper airway. I will listen to you describe your sleep history and answer any questions you might have about this treatment. I want to take a minute to discuss how oral appliance treatment can be beneficial against snoring and obstructive sleep apnea. Patients may sometimes have their airway closed or partially closed during sleep. This can happen when the tongue falls back in the middle of the throat and blocks or obstructs your airway. Oral appliances are designed to move the lower jaw forward in a forward position. When that happens, the tongue is also pulled slightly forward and out of the back of the throat. This helps to unblock the airway and allows you to breathe more normally on your own. Now, here are a few examples of oral appliances that can be used in the treatment of obstructive sleep apnea. As a member of the American Academy of Dental Sleep Medicine, I am a dentist who has had specific training and accreditation in oral appliance therapy, in the selection and the usage of these appliances for sleep disorder patients. Time does fly, but I've been a hospital consultant and clinician on behalf of sleep patients for over 12 years. The appliances that I select for patients have been proven for their comfort and their durability and their effectiveness. Here are just a few examples of some different types of oral appliances that can be used to treat sleep disorders. And the appliance can be actually selected based on your specific needs. The appliances that I use have been chosen for their ability to be finely adjusted, leading to more successful treatment. Once that you have your appliance and your symptoms are relieved, our practice is to have you do a simple monitoring test overnight in the comfort of your own home. This is to allow us to help evaluate your progress. Of course, it's always recommended that you have your sleep center test you with another overnight sleep study. Finally, I would like to say a few words about insurance coverage for oral appliances. They are covered by medical insurance only and not dental. More medical insurance companies are now providing coverage, and our office staff can assist you in that regard. We are more than happy to submit your medical insurance form, which we ask that you to provide, and we will work on your behalf to obtain the maximum benefit allowed by your insurance company. I encourage patients to be proactive in contacting and obtaining benefits from their insurance companies. I'd like to take this opportunity now to show an oral appliance as worn by an actual patient. Mike has graciously consented to help us out here today. And Mike, you've had your oral appliance now a couple of weeks. A few weeks before that, we had taken impressions of your mouth. We had taken measurements of your jaw to check the proper positioning that it should be set at. And you've had it for a couple of weeks. Why don't we just pop it in?
Sure.
The appliances usually are two pieces. And Mike has just that quickly popped the appliance in his mouth. And maybe we can get a little bit of a close-up here, and you can close all the way, and that's fine. And we can get a close-up. That's great. Just wanted to show how the appliance is in the mouth. And the thing that's noticeable right away to the casual observer is that it's barely noticeable in his mouth when it's actually in. And when he goes to sleep at night, he has the option of sleeping on his side, his back, or even his stomach. There's no cumbersome masks or hoses to deal with. And Mike, I'm going to ask you to take it out now, and we'll just talk a little bit about how the appliance has been for you. How has the appliance been working for you?
Oh, it's excellent. It makes a huge difference. Absolutely.
And you feel more energetic?
Yes, I do. Yeah.
Great.
In fact, when I was waiting for this one, I was without an appliance for about 3 weeks, and I could certainly feel a difference. And once this came back in, within a matter of days, I was back to normal again.
And it's been comfortable.
Yes.
One of the things I think we'll add in is that, prior, if you don't mind me just discussing this a little bit, you had a sleep study,
Right.
and they had even tried putting a CPAP machine on you,
Yes.
and it was not comfortable for you.
No, I just felt too restrained by it with the hoses, etc.
Right.
You try moving around, it just wasn't for me.
And even in the past, you have had some surgical procedures done way in the past to hopefully try to alleviate your sleep apnea.
Right.
And unfortunately, those procedures did not work for you.
It helped for a while, but then it just stopped, just like a dead end. Where this seems to it's as steady, as consistent. I'm getting sleep. I feel a lot better with this.
Great.
I've been wearing an appliance, as you know, for a couple of years now.
Right, right.
Started off one of the older ones, and this new model is, I'll tell you, light years ahead of the older one.
Strictly for comfort. There's been some major improvement.
Yes.
And of course, oral appliances have been used for probably 30 years or even more.
Really?
Yeah, they really have. But they've gone through an evolution of different styles and types. And we've really gotten them to the point where, with this particular one, it's very comfortable for the patients. I want to thank you very much for consenting to be on with us today.
Absolutely, anything.
Thank you very much.
Yeah.
Listen, thank you for giving me the opportunity to introduce you to oral appliances for obstructive sleep apnea and snoring. What we have done here basically today is just cover the highlights. And there's much more information online at ctsleepdentist.com, which is our website. And we are on the website linked to other informative sleep websites. So I look forward to meeting you in person and ultimately helping to improve both your sleep and your health. Thank you very much.